Today we are going to see about the topic Apgar scoring. So what is the major changes which is occurring in the child after birth? There is a profound change which is occurring in the baby is transition from fetal or the placental circulation to independent respiration. So till the birth of the baby, the mother is giving everything through the placenta. And after cutting the umbilical cord, baby starts his or her independent respiration. So for that, we need to assess the newborn after the birth. So initial assessment is done by Apgar scoring, transitional assessment during the period of reactivity, assessment of gestational age, and periodic assessment through the systemic physical examination. So coming to the Apgar score, it's the scoring which is done to assess the newborns in immediate adjustment to the extrauterine life. It is developed by Dr. Virginia Apgar in the year 1952. The evaluation which is made at first and fifth minute after the birth to give a more therapeutic value. Why the test is performed? It is done to determine whether the newborn needs any help in breathing so as to start the treatment immediately in which we can prevent the further complication to the newborn. What is Apgar score? Which is the Apgar score which has got 5 observations. As you can see in the slide, A stands for activity which indicates the muscle tone of the baby. P for pulse rate, which is the heart rate in newborn. G for grimace, which shows the reflex irritability. A for appearance, which shows the skin color, and R for respiration. Each item is given a score of 0, 1, or 2, respectively. In detail to the Apgar score, the color, if it is pale or blue in color, then we give a score of 0. If the baby's body is pink in color, but the extremities are blue, then we give a score of 1. And if the baby's body and the extremities are pink in color, then we give a score of 2. Heart rate, if it is absent, then we give a score of 0. If the heart rate is less than 100 beats per minute, then we give a score of 1. And if it is more than 100 beats per minute, then we give a score of 2. Coming to the respiration, if it is absent, then we give a score of 0. If the respiration is slow and irregular, then we give a score of 1. And if the baby is breathing good with a good crying, then we give a score of 2. In reflex response, if it is absent, then we give a score of 0. If it is means grimace or noticeable facial movement or facial changes in newborn, then we give a score of 1. And if the baby coughs, sneezes, pulls away, then we give a score of 2. Then coming to the muscle tone, if it is absent, then it is given a score of 0. And there is some flexion into the extremities, then we give a score of 1. But if the baby is active and spontaneous movement of the limb, then we give a score of 2. So we classify this based on the score into 3 categories, which is severe distress, moderate distress, and well adjusted. If the baby score is in between 0 to 3, then we call it as a severe distress, where we need to go for the resuscitation and baby to be shifted to the level 3 NICU, which is high dependency unit. If the baby score is in between 4 to 6, baby comes under the classification of moderate distress, where you have to shift the baby to the level 2 NICU, which is low dependency unit. And if the score is 7 to 10, which is called as the baby is well adjusted with the extrauterine life, where you can shift the baby with the mother after the routine care. So, till now we discussed about the Apgar score, and I hope everybody understood the topic, and thank you.